So where you're gonna take and feel, remember we did these in one class. Kinesiology? Yeah. Lumbar too?
Well, with lumbar spine.
So, and you're gonna go each spine. So your hypothenar eminence is coming along, catching onto the spinous process, and you're pushing into rotation. Okay? So you're gonna use, this hand is just a guide. It's not the fulcrum. Okay? So you're really driving through your back hand. So Blake, you wanna sit that way. Okay? So you're gonna come in this way and come here. I'm trying to get overpressure into that joint to see what rotation feels like as I come down into it. Okay? I would also do extension. Alright? So like you're gonna go this way. Yep. Tuck those elbows. You're gonna start into flexion. Most of that time, guys, it's that mid-thoracic spine that's the most restricted. So you're gonna start about T8, and you're gonna come up. As it comes up, you're gonna provide a slight posterior, really anterior, slight anterior glide, and then cranial glide up into that as he comes up. So you're trying to feel where is the most restriction coming from. Okay. And then you're gonna land. Okay, land down. Yeah, land down. Yep, on yourself. Okay. Why don't you come up here? Your joint mobilizations. Again, I would say you guys are we want you to assess the spine. Okay. Even though they're coming in and maybe they have localized pain and tenderness, you're gonna start with the high thoracic spine. So get used to starting at T1 and working yourself down. You're gonna start right on spinous process, and you should see as you're going through, remember we're assessing joint mobility and joint play at the same time. So still common mistakes, guys, are that your hands are turning white, okay? So the first thing that you guys do when you're up to a patient, set yourself so that you're ready. Okay, you guys should be confident with where your body is at. Your hand should already know. Your bottom hand should be able to go up and down that spine and apply pressure without this hand. Okay, so that's your first step. If you can have this hand on, this hand is just there to give you a little bit more pressure as you come through. You're gonna come through and really assess if there's any tenderness, like right there is pretty prominent underneath my hand. The thoracic spine can feel like that. So if it's your hand on their hand, what can we do? I mean, your hand on theirs.
Go on a date.
I put a towel, okay, or a sponge. All right. Blake, is that sore? Blake, is that sore? Yes. You're lying. Okay, so you're gonna come all the way down. You guys go ahead and move down the spine. You do not need to keep your feet planted as you move down the spine, okay? You're gonna do centrals, and then you're gonna come and do unilaterals as you come down into there. And he's super tight into that mid-thoracic region. You guys see that? Like up here, nice movement. Use nice pliability, but once we get here, nothing happens. Okay, so where do you think we're gonna do our manipulation? Probably right here. And then his paraspinals are really on. So if you really feel him, you're doing your joints, but you're also, especially with those unilaterals, you're feeling the paraspinal musculature, okay, on the side. And the right side on him is much more, there he goes, gets the little pops on that side. Much more prominent. Okay, if you have tender trigger points like cat, that's where I would come in and start to feel. You're gonna go across that rope-like fascial system that's bound up into that area. Okay, so you're gonna palpate into that area and go in that transverse way. Okay, you guys can do your transverse moves this way. It's not gonna warrant you a lot of information. I would prefer that you do it in seated. Okay.
What grade of immobilization are you doing to assess joint play?
Grade 3, because you need to go to end range. Okay, if you need to start with 2 because they're really painful, that's okay, but Dr. H just did grade 3 all the way down to assess. Okay?
So not grade 4 is right. Okay.
Also have a question for you guys. Are you doing straight P to A? Are you doing an angle? Are you doing caudal to cephalad, cephalad to caudal? What are you doing?
All of the kyphosis and spine.
Yeah.
Yep.
So like thoracic spine is probably like I think there's a 45 to 60 degree angle of facet joints, so I usually kind of follow along that angle. Instead of just straight P to A, I'll kind of do a little bit of a angulation there towards the head.
And you guys will feel the shift as it starts to curve and be more like the lumbar spine, so you'll shift your angle, right? Because those facet joints are shifting, okay, in their angles. So it's a really good point, so practice that, okay? And remember, some of you might need to hold that tissue in your hand to get that little grip.
Some people hold a battery in their
Okay,
hand.
that's weird.
So the reason I do this, I don't hold a battery.
It's hard when you
Don't
do
hold
Think about the thoracic spine, not the lumbar, but if you're in this pistol grip, basically your thenar eminence and then like the middle phalange right here is going to be abutted against their back, almost so it sits like that. Does that make sense? So sometimes that's painful for people, so we can go into like a modified one, or some people can't tolerate it all and you can do like a little cupping there, okay? I prefer this one because I can get a better lever, right? It's more of a fulcrum because it's raised up a little higher. You'll see what I mean in a second. Does that make sense with that grip? Cool. So I guess you could do it like this, but I always like to have the pistol too. So put this here.
Because you're a cowboy.
Yeah. And what you're going to do is you're going to have them hug themselves, but this is going to be in between their arms and their chest. You're going to get them to wind up here. So you're going to try to take all the slack out of their shoulder girdle so that you can target their thoracic spine. And then what I do is I kind of hold it here, okay? Because if I let go, he's then loose again. So we're winding things up, then I have him roll towards me. You can hold onto your own shoulders if you want. Then I palpate where that spot was. So for him, I'm just going to do kind of a general one because I don't know. But he feels pretty, he feels rigid. So then what I do, so this is the segment I'm going for. Looks like it's probably T5, T4. I'm going to try to go one segment above. And I'm going to angle my hand, instead of being right like this, I'm going to angle that pistol up a little bit towards his head. Because what I want to do is kind of pull down and twist and do a skin lock there. Okay, but now the position of my hand is right, like I showed you on that skeleton. Okay, so you pull down, skin lock, twist, and then I'm going to roll them over onto my hand. But I'm not just going to roll them over. I'm going to roll them over and almost extend them over my hand, kind of like this. So just bear with me for a second. So now if you notice where my hands are, so I got them locked here. I'm going to put his elbows into my armpit, and then I'm going to kind of assess and then do a manip down at the end range there.
You can put them right under, remember when we did ribs,
Feel-
guys, you can put them right under
feel that?
kind of your diaphragm too, get it in your belly, okay?
Yeah.
Or